My parents are both nurses, so I was surrounded by healthcare. But once I learned what a midwife was, I was like, oh, that's what I want to do. I was always really interested in pregnancy and childbirth. The prenatal visits are really important. So there's a lot to get through for the whole pregnancy. So we want to check in, make sure that mom and baby are doing well, vital signs are stable, they're not having any concerning symptoms. But also there's a lot of education that goes on throughout the entire pregnancy. I want to make sure that by the time that a patient's coming in to have their baby, that they feel prepared and ready for that process. We actually have a whole worksheet that we typically give out that's birth preferences, and I do kind of like that word preferences better than plan, because we all know we make a plan and things just don't go how we want. But if we know the preferences ahead of time and what's really important to that family, then we can work on doing our best to give them the experience that they want. We can see patients for a wide variety of gynecologic concerns. We can see people for their annual exams, to get their pap smears, things like that, as well as for like problem visits, if people are having issues in menopause or with their birth control or just other concerns. We can see all those kinds of patients. So I'm usually just wanting to see what's the most important thing for that patient today, what's really bringing them in, what's bothering them, and what can we get accomplished. There's so many rewarding parts of this job, honestly. I think most midwives would say like the best thing is being there for the birth and being the one to catch the baby, and I do love that, and it's amazing to share that special moment with families and with women. But ultimately, just anytime I can help someone, whether it's addressing someone's concern, kind of figuring out what's going on, finding the best, birth control or medication for them, just if they feel like, oh, this is what I was looking for, this is what I needed, I feel better, like that's a great day.